the gentleman from Georgia for 5 minutes.
Thank you, Mr. Chairman, and thank all of you for being here. And let me preface my remarks by saying that I totally disagree with my friend from Virginia. I am not going to speak from a partisan view. I'm going to speak as a healthcare professional. And I want to ask you some very serious questions here. Mr. Giza, is that correct, Giza? In the state of Georgia, where I have practiced pharmacy for the last 30 years, the regulators have approved a 21.4% increase over the average premium. A 21.4% average premium increase for Blue Cross and Blue Shield for the 2017 exchanges. This is taking into account the fact that you're going to be picking up 70,000 to 90,000 more customers from Aetna because they've exited the market. Do you, and that, as I understand it, leaves Blue Cross Blue Shield as being the only plan that covers all the counties in the state of Georgia. Is that correct?
Well, as I said, I'm here on behalf of the association, and I can't comment on the situation for any specific plan.
Well, let me assure you that what I just said is true, okay? 21.4% because of the fact that they're having to pick up 70,000 to 90,000 more customers because the insurance plan with Aetna, they exited the market. So, and that's understandable. And before they asked for the 21.4%, they were only asking for a 15.1%. Do you think 21.4% increase is a significant increase?
I would characterize that as a significant increase.
Anybody disagree with that on the panel? Dr. Cohen, you think a 21.4% increase is a significant increase?
Yes, it is significant.
Anyone disagree? Please shake your head no if you disagree. Mr. Sparrow, you look a little bit contemplating this. You don't think a 21.4% increase is a significant increase?
I do. I think you have to look, though, whether it's the average premium or the premium for the silver plans. And I'm not sure, having not looked at the data in your state, I'm not sure what you're referring to.
Well, let me assure you it is the average premium.
Well, you'd want to look at the silver premium because that's what subsidies are tied to.
You know, I don't care whose idea it was. I don't care if it was Republicans. I don't care if it was Democrats. It was a bad idea. I'm just telling you. It has been, the one thing it has not been is affordable. Don't we see that? You know, one of the first things they taught us when I entered the Georgia legislature over 12 years ago, I served for 10 years, they said, when you're in a hole, quit digging. Well, guess what? We're in a hole, and we keep digging. More plans keep going out. And what happens? We keep digging. The co-ops, I mean, how ridiculous can we be? 23 and 17 have gone bankrupt? Duh. Man, we're from the federal government, and we're here to help you. Well, guess what? We ain't helping healthcare, a profession that I've practiced for over 30 years. We're ruining it. The Affordable Care Act is ruining healthcare in America. Don't we get that? Until we put the free market back in the healthcare system, until patients have control, doctors have control, pharmacists, healthcare professionals have control over healthcare decisions, it's not going to work. It's not affordable and it's not quality. I don't care if it was a Republican idea. I don't care if it was a Democratic idea. It was a bad idea. Dr. Cohen, let me ask you a question. In July of this year, our president said, too many Americans still strain to pay for their physician visits and prescriptions, cover their deductibles, or pay for their monthly insurance bills. Do you agree?
And I think what he went on to say is that with increased subsidies, that we could address a lot of those issues.
There you go. Increase subsidies. That's what we need to do. Haven't we tried that?
And it's working pretty well. 20 million you covered.
It's working pretty well. What healthcare system are you practicing in? Obviously not the same one that I'm practicing in, Dr. Cohen.
Well, I'm practicing in the one where folks can get coverage for less than $75 a month.
What good does it do them to get coverage if they're going to have a 21.4% increase year after year?
I think
some places are having a 50% increase. Dr. Cohen, some places are having a 50% increase. Whatever you do, just go back to your offices and say, we're going to take that affordable part off. Just that's all I'm asking you to do, is just take the affordable part off. Just take that out of the title, okay? Just say you're doing it for this poor pharmacist from Savannah, Georgia.
Mr. Spiro. You said something that I think we need to stick a pin in. You said that in those states that took advantage of the Medicaid provisions of the Affordable Care Act, the premium increases are 7% lower. Is that what you said?
Yes, correct.